a senior consultant in squint and glaucoma at Shekar Eye Hospital. So now I would like to speak to you all about squint or strabismus as it is called. So I would like to talk a few things about squint, basic things, and then I will show some slides so that you can understand better. Meanwhile, any doubts or any clarification questions you people have, you can always ask on the chat box so that I can answer your questions. Now, so what is squint? So squint, or it is also called as strabismus. So people call it in various names like misalignment or crossed eyes. It's also called as malaligned eyes or crooked eyes also. In Kannada, we call it as melde kannu or tircha kannu, like, or tirchi nazar in Hindi, like that. So it is basically a diverged eyes or a misaligned eyes. You can always see these images, a normal looking child, where you can see that the black portion is the cornea, round circular, and there on either side we have the conjunctiva, the white portion, the sclera we see. So this should be in equal proportion. So in a magnified view in the lower image, you can see that the eyes are looking straight, so that the light is falling in the center of the pupil, or we call it as a cornea. Now compare with the other eye. So this is a normal looking child, and this is a eye with squint. So the eye is going inward. So this is called as a convergent squint. So the child is definitely having some abnormality. Basically, we should pick up there is something wrong in the eyes. If you find that much, that is enough, so that you can come to the eye doctor and get it checked whether there is normal or it is abnormal. So how do you detect squint, or what are the features that you people have to look to know the patient has got or the child has got squint? So you will notice that the eye will be crossed. Sometimes it goes inward or outward, and the child will be frequently blinking or squeezing the eyes. Sometimes they will look it in the corners like this and like this while watching TV or something. That is one thing. Then sometimes the people, they will complain about eye strain, headache, and then they will also have this head tilt, like they will be using their head like this or like this. If you want to view any object or anything, they will tilt their head. Then they will have a double vision. Sometimes they say I can see two images temporarily, or sometimes it will be persistent, on and off. So these are the features that will indicate towards a misalignment of the eye, that is squint. And what are the causes of squint? So most of the times it is an unknown factor, and in some situations it is neurological, like premature children, or those who have undergone some surgical brain surgeries or some issues, those who have muscle paralysis. This is eye muscle paralysis basically. Then those who are having refractive errors, like wearing glasses, they have number, so that number can also induce strabismus or squint. And those situations where the people will have poor vision, like those who are having cataract, those who have corneal opacity, that is on the black portion, we have some whitish opacity because of trauma or some other reasons. Some children are born like congenital glaucomas, and some situations the children will have this white opacity. This will not allow the light to go inside, so they will have poor vision, and consequently they will develop squint. So these are the situations, and in some situations it can be hereditary also, but that is less commonly, but it is most commonly it's an unknown factor. Now, what are all the types of squint? So if you talk about squint, now what are the types? They're mainly the normal eye looking is this one, you can see, and the normal corresponding feature of an eye of a child. So this is the normal eyes where the eyes are straight and aligned. The second situation, if you see this image, where the right eye is moving towards the nose. So there is no white area here. So correspondingly, you can see in the child that there is no white area, but correspondingly on the other eye you can see. So the eye is moving inside. This is inward squint. The eye is moving towards the nose. So this is called convergent squint or esotropia, or inward deviation of the eyeball. Next, coming to the third situation, this is the exotropia. That is, the eye is moving outward. Here you can see in this child, the eye is moving outwards here. Here the less of white portion is seen. So we can clearly make out that the eye is not aligned. Both eyes are not looking straight. One eye is moving outside. This is called divergent squint. So we have basically a convergent squint or a divergent squint, or the inward moving eye or outward moving eye. In some situations, there can be vertical squint also. The eyeball can move up. Sometimes in situations, they can come down also. So these are the variable item presentations of the squint. But we also see some situations where the patient or the adult will come telling that my friends will notice squint or my parents notice squint, but I don't feel any squint. Sometimes only I feel the eye is slightly moving. So these are the various presentation of squint. One is constantly the squint is present, like 24 hours in a day, the squint is present. But in some situation like what I am showing here, the patient will have normal looking eyes, but when we check up and see, then you can see that the eyes are diverging here. So this is called as intermittent squint. The squint is not all the time it is present. It is present only in certain situations where the child is tired or having fever, then they are not focusing on any object, so the eye tends to diverge or deviate. So that is called intermittent squint, where it is not all the time it is present. Now we also see parents bringing their children with so much of anxiety. Doctor, you see that my child's eyes is looking squinty, or the eyes are showing some deviation towards the nose. Many times this is also seen in a normal children, what we call the pseudo squint, where there is an extra fold of skin will be there. So this extra fold of skin, once you just pinch it out, so it will show off the normal area of the eyeball. So this is a pseudo squint because of the broad nasal bridge some children will have it, or some extra tissue, or which is a prominent interpalpebral fissure, or the prominent epicanthal folds, what we call it as. So those squints are called pseudo squint, and that doesn't require any treatment. Just follow up is enough. So don't get worried, but definitely your worry is justified in the initial stages. Once you meet your squint specialist or eye specialist, they will check up and tell whether it is normal or it's just squinty eyes. Now, once you know that there is squint or you have a doubt of squint, what to do? So visit an eye specialist, preferably a squint surgeon, because it is a slightly specialized field where a squint surgeon exclusively deals with this squint. But any eye of specialist is fine. There they will get your eyes check up. They will put drops in some situations. In some situations, we put eye ointment. In less than about 4 to 5 years of children, we put ointment for 3 days and check for the number. There can be hidden number or there can be an obvious number. So we have to have a detailed eye checkup along with the refractive status, whether the child has got any plus number, that is farsightedness, or any minus number, myopia, that is called nearsightedness. So all these number or these refractive errors can also cause squint. So the first thing will be the doctor will have a checkup of their vision, then check their refractive error, and then check the eye movements, and then find out what needs to be done. So we start with the glasses if the child is having squint. So proper wearing of glasses is very important. See, many times by wearing glasses itself, most of the time the squint get corrected. See, like this, in this child, the right eye is squinting, and once after the proper checkup and the prescription of glasses after wearing, the squints get corrected. So this is not a very common, but it is definitely not uncommon. So many times we can get away with the squint checkup just by glasses itself. But in many situations, we may go to the next level of treatment. Like now, parents often ask whether to wear glass all the time, why my child is getting this number, is there any other ways of getting rid of glasses? So those getting rid of glasses is secondary. The primary thing is you have to wear glass, see that the child sees properly, clear image. So once the image is clear, they will focus better, and the squint part many times gets reduced. So wear glasses, there are wonderful glasses available in the market, colorful glasses which are made of plastic and polycarbonate, which are break proof, and they are made of anti-scratch resistant. So these things are available and children can wear it. And in very young children, many times we may have to give glasses in 1 year, 2 years old children also. So those situations, the child can pull off the glasses, they are uncooperative. In those situations, you can have wonderful glasses with the plastic bands. You can put it in the back of this glass and put it behind the head so that the child won't remove it easily. And there are very wonderful plastic different colored ribbons are available, which you can tie it in the behind. The child also feels the colors get attractive, they wear it also. The other thing is proper wearing of glass is very important, and this is a nice way of showing how the glass is to be worn. The eye is in the center of the glass, and there is proper space on all around the eyes, so that even the child tilts or the slightly eye glasses drops, the child is seeing from a clear area of the glass. Not like this, where the child is dropping the glass and then see from the upper portion where the very purpose is defeated. So wear the glass properly, educate the child to wear glasses with the hands, both hands should be used to remove or wear the glass so that the sidebar won't get loose. Many times the children will have the habit of touching their glasses. So that should be avoided, because those fingerprints, the smudge, and all those dirt material accumulate on the glass. The child will not see clearly. They feel better off without glasses. So keep the glasses clean. So parents should just take care that the glasses are clean or not. Just ask the child to look at the light and see if there is any fingerprints. They only can clean it. So educate them. Initial stages, it will be the parent supervision. Later on, the child itself can do it on its own. Now, the other situation is once you wear glasses, still the squint exists. or still the vision will not improve. This is very important here. I want to introduce to a term called as lazy eye or amblyopia. Lazy eye means any organ which is not used for a long period, or if the image is not clear to the eyes, the brain will not have developed to this visual stimulus. So the neuronal network won't happen properly. So they will have a poor vision despite of wearing glasses. But if you wear glasses less than 7 years of age, in timely correction, it can improve the vision. So wearing glasses, and sometimes we give patching, that is I will show you in the next slide, so that you can use this patch to improve the vision. So what is the basic behind this one? See, eye and brain is in concert. They are all coordinating. Whatever the signal comes from the eye goes to the brain, and then the brain will process the stimulus. So like this in this image, whenever you see this eye, the light goes through this optic nerve, and the signal goes to the back portion of the brain where it is processed. So whenever a clear image is formed, the neuronal connections happens properly. If the clear image is not formed due to various reasons like not wearing glasses, if there is any number, if there is any squint, if the squint is there, then the image doesn't fall properly, then the neuronal connections will not be correct. So the neuronal connections will not be established in a proper way. This leads to the lazy eye, that is called amblyopia. That's why our aim will be to make the eye straight. Signal should go clearly to the back of the brain, and the neuronal connections or networking happens in a proper way. So that is why what we do is we do patching to treat them. So patching is just like a sticker or any occluder or any paint or any sticker is applied on the glass or on the skin directly. So this is a classical patching that we do for a normal eye. See, the basic principle here is we have to patch the normal eye and allow the lazy eye. This is the weak eye or the squinting eye or the lazy eye. So we should patch, and then if the child is having glasses, we should wear the glass. And this is to be worn for a duration described by the doctor, like 2 hours to 8 hours, depending on the type of amblyopia. So the doctor will tell you how many hours you have to wear, and alternately, sometimes we have to wear alternately or on one eye, depending on the vision. So once you wear the glass and the patching, what happens is the patient is forced to use this weak eye, that is the amblyopic eye. So like in the next image, I will show you. So even these are different types of patches where you kind of brown colored patches. The patient is having lazy eye in the right eye. This is the normal eye. We patch the normal eye and allow the lazy eye to see. So he is forcibly made to see through the weaker eye. If you give a work to the weaker eye, then the stimulus goes to the brain and the neuronal network and connections happen, and that amblyopia or the laziness reduces. It's just like any object or any organ, if it is not used, you do a gym for the right hand and you don't do any exercise for the left hand, so the left hand becomes weak compared to the right hand. So similarly, the eye also, one eye is weak. That's in this image, because the right eye is weak, we want to give more stress or exercise or activity to the right eye. How do you do it? By doing patching. Cover the eye, forcefully make him to see through this eye for time duration between 2 hours to 8 hours. Sometimes we have to do full day patching also, depending on the vision, so that he will see better over a period of time and have a regular follow. So this important part we have to understand in case of amblyopia. See, this amblyopia or the lazy eye is a very second common cause of visual impairment in children. So first cause is the refractive error, glass number. Second is the amblyopia or lazy eye. These are the two important causes for poor vision in children. Now there are colorful patches. The parents have often complained the child won't wear patch. It looks very ugly or something. So there are wonderful patches with all sorts of tattooing or those cartoon characters inscribed on the patches. So you can select any of these patches. And many times, as a part of the treatment, initial treatment, we will examine the child or the adult, whoever has. Then if there is a small squint or occasional diplopia, many times we have to prescribe prism glasses. These are specialized glasses where you just apply a sticker, thin glass strips will be there. That will help in aligning the eyes, so that sometimes patients who have double vision and all, they can get corrected with this simple specialized prism glasses. This is another part of treatment. Now, who all can get squint? So there is no age group which is barred from squint. Anyone can develop from newborn to the elderly, and any person can develop in between. The person who never had squint can develop squint if any adverse event happens in the eye, something like trauma or another issues. Now, this is the range of persons who are having squints. You can start with this about the child present at 6 to 8 months of age, having the right eye squint. You can see this is about 5 years old child having a left eye squint. You can see an adult having a right eye squint. about 25, 30 years of age. This is another adult, much more elderly, like around 50 to 55 years age group. So you can see squint in all age groups. But those who come commonly presenting is in the childhood because the adults feels that, okay, I already passed that age of correction or some other issues. So they feel everything, I'm married now, why do I need any squint examination or evaluation? It's better always, I will show in subsequent slides how important it is to get your squint corrected even at any age group. But it is more important to get the squint corrected in the younger age group. And very important red flags in squint is that what are the danger things where you have to report to the eye doctor is very important. That sudden onset, if someone is having normal eyes, suddenly you'll have squinting from past 2 days or 1 day, and they will start developing double vision. You should please show. And they suddenly develop eye pain, eyebrow pain, headaches, and all. You should come and show. Then they will have some giddiness and gait imbalance. And those who have diabetes, usually associated with diabetes or severe rise in eye blood pressure. Those who have trauma or any head injuries, they fall, they will suddenly start having a squint eyes or they will have two images. So they should come and show immediately without wasting time. This is very important thing. Something happening in the brain can also show in the eyes in the form of squint or sudden onset squint or sometimes shaky eyes or what we call it as nystagmus. Now, once you come, you will have examination and you will just chart out what is suitable for your eyes in the form of glasses or and the spectacles and patching. The child has got lazy eye. Not all the child having squint can develop lazy eye, but majority can have mild lazy eyes. So to enhance the vision, we will do patching, and as I described before, some situations you may have to give eye exercises, a simple eye exercise to focus on an object for a constant period of time for about 1 minute or so, and over once in 10 times in a day. So we'll exercise our convergence exercise to strengthen the focusing muscles. Then sometimes it can be done on machines like this, and the last resort is surgery. Now, why do you need surgery? And when you need surgery? Because many times patient parents will just get afraid when we say surgery. So when is surgery is required? Surgery is required in children where the squint is not corrected even after wearing glasses. The vision is not improving. They have significant symptoms. So we have to operate. And in young children, the convergent or the inward moving eye, we operate as early as about 8 months or 10 months itself. So, and how do we do this surgery and what type of anesthesia we give? Usually in children, we give general anesthesia, which is obvious. We have very senior anesthetist who deals with this pediatric anesthesia. They give anesthesia and then the surgery is usually a duration of 30 minutes to 45 minutes or so, less than an hour surgery. In adults more than 14, 15 years of age who are cooperative, we do local anesthesia, small injections to anesthetize the eyeball so that the duration of surgery, the patient is cooperative, won't feel the pain. And coming to complications of surgery, yes, there are complications, but it is very, very less. And definitely in a trained hands, it is much more less, and they are very transient, and it can be handled easily. Just in case of any eye surgery, the eye squint surgery also has got few of the complications. Like the patient can have few days of pain, redness, which will go off on its own by giving tablets and drops we give. And some other situations, the corrections will be slightly more or slightly less. We are called as under correction and over correction. Many times we do it intentionally because over a period of time the eye focuses properly so that we under correct. Sometimes we have to over correct so that eye again focus it back. So we give time for the dynamic eye to change its alignment. And some situations there will be small perforations or retinal detachment, which is extreme. In fact, in our hands, I have not seen all those complications, but we can easily handle those situations if it arises. So not much of complications, we can easily handle those situations. And why do we do surgery? One is apart from improving the vision, very important situation is cosmetic purpose. See, a lot of this act as a cosmetic blemish. The child will avoid his friends, and the friends will start teasing. Even it can be happen for adults also, that your eyes are squinting, you look very crooked, or they make fun of them. So for cosmetic alignment, we may have to do surgery. And apart from the cosmetic alignment, if it is done in a younger children, less than 10 years or less than 5 years, it will improve the vision because eye becomes straight. The very important factor, but I want to stress, is to maintain the stereo acuity. What is stereo acuity? Stereo acuity is one where both eyes is aligned, which has got a normal vision, so that it will help in seeing the depth perception. So whatever that we see is a three-dimensional. So that can be achieved only when the eyes are straight without any squint, when the vision is normal and they are focusing on an object. So I've just demonstrated this stereo acuity concept. We all know this. See, like when you see a tree, In a side-on position, like when you see straight-ahead tree, if there are two trees are there, you can see there is some difference between the two trees. And the one tree looks, the nearer tree looks bigger, and the farther away tree looks smaller. The same thing, if you see from the height, top view, you can always clearly make out that there is a lot of difference between these two trees. So this separation, like you see a police standing here and a tree, how far the person standing behind the tree or in front of the tree. So this is called depth. So in a practical situation, you can see the person is driving or going on a road. So you can see a front car coming closer by and another car which is of this much distance. We can always gauge the distance or the depth. The car is so much far away and with what speed they are coming. So all these things is possible only when there is depth perception. This three-dimensional view or the depth perception is very important for a human eye. That is the maximum a human eye can achieve. That's the depth perception. If that is gone, then it's compromised vision. So we always should have a very proper three-dimensional or a fully stereo acuity having eyes. So here, if the patient doesn't have stereo acuity, he may not gauge the distance between these two cars or what is the depth and how fast it is coming. So he will have to be very slow or cautious in his approach. If the eyesight is good, the eyes are aligned, there is no squint, there is a good stereo acuity or there is a good three-dimensional vision, he can really easily maneuver through these areas. He can just quickly go through this area because he knows how far the car is and with what speed it is coming. So it will help to align the eyes and take your actions swifter and quicker and safely. So these are very important in having stereo acuity. And we do check for stereo acuity in all children who comes for squint evaluation. We have specialized charts where we assess whether the child is seeing those objects clearly, with the object appears to be in front of you, and assess the binocular range of vision, and accordingly we will chart our plan. So you know the concept of three-dimensional vision, where children are made to wear glasses and see that the images come in front of you. That is typical of three-dimensional vision. The movie will have a flat screen; it can't have the depth. So we give glasses, dissociate, and make the eye appreciate that the real-time issue. So we can see wonderful movies. We have the real-life experience. This is all possible if the eyes are aligned, there is no squint, and have a proper depth perception. That's why we all have to aim to have the maximum and the best vision possible for a child or an adult. Now, what is the concept in squint surgery? See, in squint or a normal eye boy, I will introduce to the part of anatomy. There are 6 muscles for each eye. So this is one eye and the 6 muscles which are spread. It goes behind the eye and the root of the orbit, and then the back portion of the eye, the signal goes by optic nerve to the brain. So all 6 muscles in the right eye and the left eye will work in harmony synchronously. So if the right eye wants to move outward, the left eye also proportionately moves outward. The muscles which are helps in moving the eye to the right side will get an equal and proportional signal from the brain. The brain is the high command. So if your right eye has to move about 20 degree, the left eye also gets a similar signal of and it moves to the 20 degree. If there is any impairment in the signal from the brain, so one eye moves 20 degree, the other moves 10 degree. So there is a disharmony, and then this relates to squint. Or so this is typical of those who one eye is moving properly, the other eye is not moving. This is leads to squint eye and doubling of image and discomfort of eye. Many times this squint can be paralytic squint because of injury or any stroke or any diabetic situations where the blood circulation to the brain is less or the injury can happen. The signal won't be appropriate to the each eye. So one eye is getting a full signal, the other eye is getting a lesser signal. Sometimes one eye is getting more signal. So these situations, the squint happens. The eye moves, one moves more, one moves less. So comes the role of surgery where we will weaken the stronger muscle. So we are weakening here, the muscle is moved backwards. One muscle moved backwards so that the muscle is weakened. In the other situation, we have to strengthen the muscle where we have to trim the muscle in the part amount, depending on the amount of squint, we'll trim the muscle and then move it forward so that we strengthen the muscle. So either we strengthen the muscle or we weaken the muscle depending on the type of squint. And we operate usually one eye. In children, we operate on both the eyes also. Don't get scared. Why only one eye? My child is having one eye. You are operating on both eyes. It's a common question being asked. So it's not like that. The squint is a both eye phenomenon. Both eye response. If you operate on the right eye, the effect comes on the left eye also because both eye are wired. So if there is something happened to the right eye, the left eye also feel that problem, and then accordingly it will adjust. So whatever happens to the left eye, if I have come to the right eye, whatever happens to the right eye, it will affect comes to left eye. So we operate many times both eyes also. Depending on the amount of squint, we operate both muscles, 2 muscles, sometimes 1 muscle. Sometimes we operate both eyes, sometimes we operate one eye. In children, many times we operate on both eyes, single muscle. In adults, many times we operate in two muscles in a single eye. So in case of large squint, we may have to operate both the eyes. So two muscles, sometimes three muscles. What is called as oblique squint? There are four horizontal muscles. There are two horizontals and two vertical and two oblique muscles. So depending on the type of squint, nature of squint, eye moving up or down, moving more high sideways, we have to tackle each muscle according to the type of squint, which on examination will pick up and accordingly will advise. So not to worry, it is the domain of the squint surgeon. So don't worry about this. I'm introducing that how a squint surgery is handled. So it is just a interplay of two muscles. We have to adjust one muscle so that the other eye also responds. If the eye is weak in the right eye, it will strengthen the muscle of this eye and weaken the other eye. So that is how it works. Now, how the patient manifests after the squint surgery? See, this child was given glasses, and then next stage we have to take up for the surgery. So right eye was in fact, technically speaking, we operate on both the eyes, and then we see the child is having a very well aligned eye. We did it at the age of about 8.5, 9 months of age. Now the child is around 11 years. We saw recently about 4 months, 5 months back. He is happily going to school with a very well aligned eyes. We don't make out whether the child has squint or not. Now operating at a younger age group is very important because the child is one get aligned. They will not develop amblyopia, or even after amblyopia, we can handle the laziness very easily. Then the child has got a high chance of maintaining the depth perception, that's stereoacuity. That's very important. So we all three parts of the vision is restored in this child, provided we show the child early in age and get it corrected. So don't go by your elderly. Earlier we used to say, no, child is having squint. No, don't worry, it's a sign of luck. No, it's not sign of luck. It is ignorance. Please don't fall prey to such words. Any problem with squint in child or any doubt in child, please come and show. This is another child which I showed in the previous photo. Has a divergent outward going squint, was after surgery. You can see the eyes are well aligned. Now another 10 years old child with a left eye squint. Now after surgery, you can see the eyes are a bit straight. Now there are other aspects to the squint, not only that cosmetic things. So see social aspect, like a lot of patients we see the younger age group, like between 20 to 30 or 35 years, marriageable age, what we call. So they come with the squint and they feel they think that the elderly says, oh, it's okay, leave it like that, the squint get corrected on its own or nothing to worry. But their chance of getting marriage proposals gets rejected very frequently, because whenever someone sees these abnormal eyes, they feel that there are other problems associated, which is unlikely. Anyone having squint need not have any other associated issues. They can have only purely squint eyes, but the whole body is working normal. So don't go by this one that someone is having squint has got some other issues. No. But some myths and wrong perceptions are there that there can be some other issues. So they reject the marriage proposals. So a lot of patients come before marriage, they get it done, or before marriage, they want to look well. Their spouse will or their would be will accept the patient with grace. They say squint is there, was okay, but for photo and other issues, cosmetic purpose, they feel, can you make the eyes straight so that I can look better on photos or on videos after marriage or during marriage. So we do operate this one. This will be work mainly for the cosmetic reasons. And the other issues, see, the child, this adult was operated, and then the post surgery, she was very happy, and a lot of proposals came, and she is having a happy married life. Another situations where she came with a very large squint. You can see the eyes totally move outside. Then we have to operate. In fact, we have to operate both eyes to correct to the optimal level. Many times the full correction may not be achieved. A partial amount of squint will be left, residual squint. But that looks okay in most of the cases. Only if it is too large, when one eye surgery won't work, it won't give a desired result, then you go for the other eye. And this is one situation where this person, a salesperson actually, he had a right eye squint. So he was having low in confidence. He appeared depressed and he presented, sir, can you do something for my eyes? When I went into the history, then you find out that he feels very shaky or very, lack of self-esteem or confidence. Whenever he meets his clients or tell them, the clients used to have a smile on their face or they used to giggle, because whenever he sees them, the other person also, he will be seeing the other person, because one eye is looking this direction, the other eye looking straight. So he will also used to feel that inferiority complex they develop. My eyes are not straight. The patient, the persons who are in front of me won't accept me properly. So these are situations where those who are in marketing and those who have to go in public and tell that they find a lot of difficulties in those situations. Then we operated him, just to boost his confidence, if we can get it corrected. And then after surgery, his eyes were well aligned and he's a bit happy so that he can face the public very confidently. Another person, the situation where an IT crowd or those who involved in computer work and all, he used to have this squint. And many times this is intermittent squint. Many times I used to be straight and most of the times I used to be squinting. Along with that, he has this eye strain, what you call asthenopic symptoms, pain around the eyebrows and all those things. And he can't work for longer duration on the computers, which is really very important, and get tired easily. And along with that, of course, we have the cosmetic issues where they may make fun and all those things. Nowadays, that fun quotient has come down because people are accepting, they know there is science behind this. But still, you have this in your mind that my eyes are not straight, my organs are not correct. And there is almost an element of strain. You can't work normally for a longer duration. So in this situation, if you do the squint surgery, this is after surgery, the eyes become straight, the straight part is taken care of, he can work more for a longer duration, happily he can work. So this is one issue. Now in old age also we can operate. Now old age in the sense middle age, like kind of thing. This is one lady who came, she did not come, in fact the children brought them. The children of 20, 22 years old, they came. That mother doesn't want to go outside, doesn't want to have photography because she knows that there is squint and the photos won't come properly. She used to be withdrawn. She doesn't enjoy parties and all, going out for functions and all. Children, once they realized, now they are net savvy after 16, 18, they start seeing net, they feel that there is some squint. So can it be corrected and all at this age also? When she was told, she says, no, I don't want any surgery or anything because I already old, no one can correct at this age and all those things. No, it's not like that. Those children had so much of respect for their mom. They brought them to me and then they asked whether can you do anything at this age. I told, why not? We can do it. Other parameters are all okay. Then I evaluated it, then got it done. She's so happy now. She can now post more frequently photographs, enjoy the functions and outdoor. So that inferiority complex and all those things are gone away after the surgery. So that eyes are straight. They will have some amount of inferiority complex is taken away from them. It may not improve the vision. Many times they can have a poor vision because it was not tackled in the younger age group. So the vision may not improve, but at least the alignment improves. Cosmetically, she looks much better. And if there is any strain factor, that is also taken care of by squint surgery. So to summarize, do not neglect squint. Any amount of squint or any iota of doubt you have, please visit eye specialist or a squint surgeon and get it checked. So we are well equipped to say whether the squint is there or not, if there's a pseudo squint is there or not. And very important is don't look at the age. Any age, usually first 3 months, there will be dynamic changes in the baby's eye. After 3 months, the eye starts settling down, the eye starts becoming straight or very focused. So any child having weak eyes or after 3 months of age, please come and show. We will check and see if there is any issues because younger children, 6 months, we see squints a lot of time. The squint can be secondary to other issues. The child can have a cataract, they can have glaucoma or so many other issues which are hiding in the retinal problems. So those pathologies we can pick up and that is manifested as squint in children. So we should see, and most of the time they can have pure refractive error, the glass number. Once you give glasses and do patching and then the third step if required, we may have to do surgery. So if you do these 3 steps, with a proper and early eye checkup, we can restore the supreme visual pedestal that the person can achieve, that is the stereopsis or the 3-dimensional vision. Otherwise, the person will be compromised. It is our responsibility to show a child early in age, be it for refractive error, be it for squint or any other pathologies, so that if it is corrected at the early age, we can restore all the 3 dimensions of the visual spectrum. Then we have these glasses, patching to improve the lazy eye, and the last step is the surgery, which is the mainstay of treatment if it is not corrected by these 2 primary treatment modalities. The advantages of any surgical intervention is, as I told, to improve the self-esteem, to build up the confidence of a person and improve the communication skills. A lot of patients come back and tell that my life has changed after the surgery. I can interact better with the world and they have better job opportunities because the eyes are straight. Then you have a lot of opportunities because there is no deficiencies. You will be behaving in a much confident manner. And they have a better reading stamina or a driving stamina because if the eyes are squint, he has to put extra effort to make it straight and focus on any object. Once the eyes are corrected, the eyes are aligned, then the strain part is taken care of and he can endure more to these reading habits or driving habits. These are the benefits apart from having this cosmetic, the primary one, cosmetic alignment, improving the vision and maintaining the three-dimensional vision, that is the stereo acuity of the person. So these are the main parts of squint. Nothing to worry. Come and check your child or any adult. If you have any squint, we can easily have a checkup and appropriate glasses or patching is done. If required, squint surgery is done. It is very simple surgery, although it is a complicated if you look at, but in a trained hands and expert hands, we are doing it for many years without any of those complications. So we can easily handle the squint surgeries, and we have good anesthetists at hospital, and we have this COVID era, we have a hospital is very well equipped to handle all these situations with all adequate precautions we take. We also take care of all those guidelines being formulated by the government of India and our state government and BBMP, so that we adhere to all the protocols and maintain the strict hygiene measures and the sanitary measures to see that the patient is having a very comfortable stay and a surgery if required, and the doctors or the staff of the hospital also have a safe environment. So these things are very important. During COVID times, I want to highlight, see now the lockdown has opened. So it doesn't mean that the virus is gone. The virus is very much there, but because of other issues, the lockdown has to be opened. We have to be very careful. We have to stick to those three main goals. Wearing mask, never remove the mask, even never remove the mask below the nose. We have to wear and cover the whole nose and mouth. Both hand hygiene, when you outdoor carry a hand sanitizer, keep cleaning your hands if you touch any other objects. When you are at home, you can use very soap and water for about 20 to 40 seconds, wash your hands. The third thing is maintain that physical social distancing of 1 meter, come what may. Maintain this thing. Avoid crowded areas and the closed spaces where high AC is there for a longer duration. So go into open environment, maintain all these social distancing, wearing mask, hand hygiene. We at our hospital are very strict with all these parameters. We maintain all these things for the benefit. So we should see that the virus doesn't spread. It's our responsibility as doctors, as healthcare professionals, as our hospital follow Shekar Eye Hospital, we follow all these protocols so that we see that we stay safe, we don't spread to others, and others or the patients don't spread to others. So the spread of virus has to be contained by all of us at our levels, and that is being done. So don't worry about squint. We can always handle the squint easily. But thing is that you should come and get your eyes checked at the right time, and don't hesitate to come to the hospitals. Now hospitals are having a safer environment now, and stay safe and stay healthy. Thank you.